Hello, I'm Armida Carr, bilingual speech-language pathologist, owner and founder of New Horizon Therapy. Welcome back to Therapy Thursday, where I answer your questions or talk about a topic as it relates to speech or occupational therapy in either children or adults. This week, I will be talking about aphasia in adults, just because I had a question about what is it and what does it feel like, trying to explain it to family members. Aphasia is when adults lose the ability to communicate or to understand, and most commonly happens after a stroke, but can also happen if we have, if there's tumor, if we have a virus in the brain, or if we just have a traumatic head injury that impacts the way we communicate. Our brain is an amazing thing that we have that helps us communicate, and I always say it's like a little wheel. There's tons of little wheels from the minute language comes in to the minute we are going to say our words, and if one of these little wheels is impacted, it impacts the whole line. So when a stroke is suffered, I always say, there's different branches. It is up to speech-language pathologists to kind of assess where the damage occurred, what part of the brain was impacted, and how is language or communication or understanding has been impacted. And again, it can look very different depending where that injury occurred. But it is something that families sometimes they think snap out of it, or they can do it, they just don't want to. But in reality, it's almost like a bruise in the brain, and that bruise needs time to heal. And when that therapy is provided from the get-go, we can start reconnecting the brain and kind of try getting that to heal. But if the intervention is not done soon, that brain can't regrow that connection, and it has increased difficulty in trying to repair itself. So the lasting damage is longer, and possibly not even not having the ability to recover that language. But I do explain aphasia to people that are having a hard time understanding. I always say, sometimes when you go out, or when you were in your drinking days, and you went out and you had way too many drinks, and you couldn't focus, you couldn't think, you couldn't say the words you wanted to say. You knew exactly what you wanted to come out of your mouth, but you just couldn't do it. You were just in this fog. But I know none of my patients drink or my therapists, but anyhow, we go through that period of clarity that we don't have that clarity that we need. So that, absolutely impacts how we communicate, and, similar with adults. But instead of that one night where they're in a fog, it's kind of long-term until they get that recovery and that therapy that they need to be able to return back to where they were, because the brain needs to be retrained on what it needs to do and able to communicate. So thank you so much for joining me today. I know today was a little bit longer, but I think it's an important topic, and please call. We are here to help and to answer any further, clarify any other questions. Thank you so much. Bye-bye.